I'd like everyone to stop and think for a second. I'd like you to think back to your past, specifically your childhood. Ponder about what you were doing as a child. Maybe running around or playing games of some sort. I myself was a very active child. I spent a lot of time participating in physical activity. At some point in time, you may have children yourself, or maybe have a younger sibling who is still a child. Whatever your context is, knowing how exercise benefits children is important because some of these principles apply to everyone. Exercise is beneficial to children because it reduces the risk of developing health conditions, increases energy, improves brain and mental health, and helps build strong bones and muscles. I have and always have been an active person, so I have a first-hand account on some of the benefits exercise has to offer. I've also thoroughly researched the specific benefits that exercise has on children. First, we will examine low risk of developing health conditions. Second, we will discuss how physical activity can increase energy levels. Third, I will explain how exercise can help develop the brain and improve mental health. Lastly, we will talk about how strong bones and muscles can be developed with exercise. Exercise is beneficial to children because it reduces the risk of developing certain health conditions, increases energy, improves the brain and mental health, and helps with strong bones and muscles. A lower risk of developing certain health conditions is a huge benefit of exercise for children. One very common health condition that can be lowered is heart disease. The National Institute of Health in the 2017 article titled Benefits of Exercise. Exercise helps strengthen and increase circulation in the heart, which helps lower heart disease. Another way heart disease can be lowered is by improving high-density lipoprotein cholesterol, which is the good cholesterol. Another disease that can be prevented is diabetes. The National Institute of Health also mentions in their article that exercise helps lower blood sugar and makes insulin work better. Exercise also is associated with a lower risk of developing certain types of cancer by lowering hormone levels, improving the immune system, reducing inflammation, and preventing obesity. So now that we have addressed the decreased risk of developing health conditions, let's look at the correlation between exercise and energy. Regular physical activity can work to increase energy levels. Exercise actually allows for more energy rather than less. Colette Bausch, a medical journalist, in her 2008 article states that this production of energy occurs in a tiny cellular organ called mitochondria, which is responsible for producing energy. So when you exercise, your body produces more of this mitochondria to meet the needs of the energy that is being consumed. Energy is important for children because it allows them to grow and function. Children tend to be very active, so they need that extra amount of energy that is accompanied with exercise. The increase of energy levels is important, but knowing how exercise can help develop the brain and improve mental health is equally, if not more, important. Exercise helps with brain development and mental health. Angelina Tal, a medical writer, in her 2017 article titled Exercise Benefits Children Mentally and Physically, states that exercise raises the heart rate and allows for more blood flow to the brain, which leads to a process called neurogenesis. This is the production of neurons, and these neurons are what help us think and help store memory. Exercise also allows for the production of neurotrophins, which are a protein that aid in the survival and function of neurons. Myla Charvet, in her 2019 article titled Why Exercise is Good for Your Brain, says that exercise helps promote the production of these neurotrophins. Exercise also helps children improve their mental health by bringing calm energy and reducing stress and anxiety. And this helps to prevent mental health conditions that can occur in childhood. Now that we know that exercise lowers the risk of developing health conditions, improves energy, and helps develop the brain and improve mental health, let's look at the physical aspect concerning bones and muscles. Strong bones and muscles can be developed with exercise. Heather McDonald, a medical writer, in her 2012 article titled Physical Activity in Children's Bone Health, stated that physical activity is integral for maintaining and developing a strong skeleton. So having a strong skeleton is very important for children because as they grow, it helps them develop or prevent fractures. Exercise also works to increase muscle mass and strength, and this helps children with the ability to do things. Also improves their coordination and balance. So in conclusion, first I described the low risk of developing health conditions. Second, I explained how physical activity can work to increase energy levels. Third, I discussed how exercise can help develop the brain and improve mental health. Finally, I talked about how strong bones and muscles can be developed with exercise. Exercise is beneficial to children because it reduces the risk of developing health conditions, increases energy, and improves the brain and mental health, and helps build strong bones and muscles. So now that you know the benefits exercise has on children, think back to what we thought about earlier. Do you remember experiencing any of these benefits as a children? The chances are that none of us did, but yet we experience these benefits nevertheless. Exercise not only helps children grow physically, but mentally as well.